Hi, Paul Slackis, Good News Broadcast, Good News Planet, and Pause the World for Peace. We're going to talk about a serious subject today. Living with schizophrenia is not what most people think, especially since it's not always portrayed accurately on TV shows and in the movies. And I've been in the TV business for 50 years, making TV shows, but I did a show called The Brain, in the Brain series at PBS many years ago in '82. And I don't know, there I think maybe we talked about schizophrenia in an accurate way and to learn. And our psychiatrist with us today is extraordinarily accomplished. Dr. Christoph Correal. Hi, how are you? Are you okay today?
I'm fine, thank you. And thanks for having me talking about this very important topic of schizophrenia.
He's written and co-authored 850 journal articles. He's here in New York and in Berlin at the Zucker School of Medicine at Northwell, Hofstra Northwell, and then in Germany at Department of Child and Adolescent Psychiatry at the Charité, I'm not sure if I say that right, University of Medicine in Berlin. So, it seems like a lot of psychiatrists came out of Germany, and I wonder why. But I think the Sigmund Freud, did he have anything to do over there?
Yeah, I mean, he's from Germany, Austria. That was one period together. But yes, I think we're interested in the mind. And when the mind goes right, it's wonderful. But when it goes wrong, it can really be a disaster. And schizophrenia is a severe brain disorder. It's complex. We don't fully understand where it's coming from. But it's certainly not what people sometimes think, like split personality with multiple different personas. It's one person who can't have all of the mental operations work in sync. So it affects really, when you have schizophrenia, the way you feel, the way you act, the way you think and speak, but also integrate and perceive information from the world, which can lead to misinterpretation of stimuli, which then leads to people feeling that they are being haunted or that somebody is doing something to their bodies, that they see things that are not there. And I'm quite excited that you have me today to talk about schizophrenia, but also to be partnering with Janssen Pharmaceuticals to educate about this disorder and also about long-acting treatment options that have been developed.
Well, Janssen's one of the greatest in the world, corporation, they have a major corporation and association with them, J&J. I believe, and actually we've over the years done many shows with Johnson & Johnson and Janssen, and because they're serious and they get to the bottom of concerns of humanity on a large scale. Tell us, I mean, how do you diagnose somebody? I mean, does somebody walk into your office and they're all over the place, in quotes? How does somebody, first of all, how do I know if I'm schizophrenic?
Yeah, so these are multiple questions. So let's try to get at each of those. No, that's fine. It is complex.
I might prove I'm schizophrenic. Does that prove I'm schizophrenic?
No.
No, all right, good. Thank you.
No. So I think first there is no brain test or blood test that we could do to define or diagnose schizophrenia or any other mental disorder, by the way. We do this by asking people questions, observing them, so old school in a way. So in that sense, it's also something that everyone can do because we have those tools. And what are the key symptoms? So the key symptoms are so-called positive symptoms. These are not good symptoms. These are symptoms one shouldn't have. Hearing voices, seeing things, having delusions about things that are not true, having thought disorder, that's maybe what you meant with all over the place, not being able to string thoughts together. Those are the positive symptoms, acting bizarrely. But then there's also the negative symptom part, which is these are things people should have and they don't. Not talking much, not having emotional expression, being amotivated, not enjoying themselves, and also not being social, not wanting sociality. And then a third cluster is cognitive disability. And actually those together then converge on not being able to function well. Self-care, interacting with people, having school and work activities and leisure activities. All of this can be very much affected negatively by these symptoms when they're not controlled. The good news is, although we don't fully understand the disorder and we can diagnose it only with clinical means, we can treat it. We can treat it with medications, but which medications makes a difference? And maybe we'll go into that as a next step if you want.
Yeah, I do. But let me ask you a quick question in between that. I remember in '82, we went into the National Institute of Health in Bethesda, Maryland. I think there was something they called a PET scan. And does a PET scan have anything to do with what we're talking about? But this was in '82, so that's a lot of years ago. Have we improved, or the PET scan, is that something that can help in diagnosing and seeing what's going on?
So, I mean, this is a very erudite question, and it's very pertinent that at least in the scanner, we can understand that on average, people with schizophrenia have more of a neurotransmitter called dopamine in certain areas of the brain that have to do with thinking and integrating stimuli in the brain. And in some patients, it's not dopamine, it's glutamate. But the problem is, this is research. It's not scalable. We can't really put everybody into a scanner, and it's differences on an average scale. So what we can do is actually treat patients where we see the symptoms right now to help them achieve their goals better.
Okay, let's talk about treating a patient, because proof is in the pudding, as they say. If the patient looks better, feeling better, talking more, and doing, this is good news. Yes, as you say. So what can we do, and what is being done?
Yes, so I think we can differentiate the treatments into psychoeducation, having the patient and the family learn about the condition, talk therapy, either individual or group, getting more grips at what my mind is doing and trying to be able to steer that a little bit more consciously. And then there's also family therapy, which has shown to delay the onset of hospitalization and relapses. But we know that so-called antipsychotics are the mainstay of treatment. And they can be given once daily, which is how you would usually start. But then research has shown that lengthening this interval of taking medications to a long-acting injectable that's not given 365 times a year, but less, can help patients stay the course. Because staying the course and being adherent is really difficult for many, many patients, with all conditions, but particularly with schizophrenia. And Janssen, that has been dedicated to mental health for really 6 decades now, has developed long-acting injectables, and there's quite a portfolio. There is invega Sustenna, which is once monthly treatment. That's 12 times rather than 365. There's invega Trinza, which is every 3 months. That's seasonal treatment. Spring, summer, fall, and winter, 4 times. And there's invega Half-Year, and the name gives it away. It's every 6 months, twice a year. And in a recent study, quite excitingly, that was an open-label extension study where patients had been in 1 year before, and now they entered another 2-year period. Approximately 96% were free of relapse for the whole 2-year period, and nearly 90% finished the 2 years of treatment, which is also showing us that patients vote with their feet. I can tolerate the medication, I can go on with it, and I want to stay on it. Obviously, like all medications, also long-acting injectables can have risks and benefits, and in order to educate oneself about this as a loved one of a person with schizophrenia, or someone with schizophrenia themselves, it's important to talk to the healthcare professional to learn about the illness and also about treatment options.
2 quick questions, because I know you're busy speaking to a lot of people, and it's wonderful what Janssen has accomplished here. First one is, what would you tell a family who had someone in their family that had schizophrenia?
Yes, it's important to say, okay, this is a severe illness. Your loved one needs treatment. Help them understand the need for medication treatment and help them stay the course. Consider a long-acting injectable, because then everybody knows exactly when the patient is on the treatment or is off the treatment. But second, have hope. Try with the stability that these medications can give also to reintegrate the person as early as possible into social networks so that they can have meaningful relationships, into education and work, but also leisure time. And get more information. And one source of information is the healthcare professional, but another one is a very nice website that I recommend to my patients and their families. It's Janssen, LAIS.com, JANSSEN, LAIS.com, where people can then at their leisure understand what the illness is, what treatment options are, and decide together what may make the most sense.
Doctor, thank you for doing this kind of work. It's very, very important. This affects a lot of people, and to help them and help the families, because it's, takes over a family. That's good news. Thank you.
Absolutely. It's about 2.8 million people of adults that live with schizophrenia in the US, and we need to help them better. So thanks for putting this on your show.
You got to multiply that times 15 or 20, right? Because that affects every people all around. Thank you so much. Good job.
Absolutely. Thank you. Take care. Bye-bye.
Take care.